Perineal card in early postpartum, an efficient tool to evaluate and treat pelvic floor dysfunction.
Good afternoon, everyone. I'm honored to be a part of this Congress. I would like to thank the Congress organization, and my tools is the Perineal card as effective tool to evaluate and treat the pelvic floor dysfunction. Before starting, it's important to mark that any woman, independent of pregnancy, can develop in her life pelvic floor dysfunction, and the postpartum period can be related with the onset or aggravation of this disease. In this graph, we can see how, with aging, independence from pregnancy, the risk to develop some symptom of pelvic floor dysfunction increases. During the life, in fact, the potential risk can be divided in continuous, like aging, occasional, like pregnancy, and reversible, such as weight gain, smoking, and habits as well, like constipation, not hydration. And moreover, we should remember that during the pregnancy, there are some modifications that can be added to risk factor. The bladder is pushed forward and upward. The trigon from concave becomes convex. The position of uteral meatus changes. We have hyperlordosis and sacroiliac mobility increase the weight, increase the pressure on urogenital hiatus and the stress of anterior wall of perineum. And we have also hormonal changes that reduce endopelvic fascia elasticity. Remember also that during the labor, we have some modification. Increase the length of the anus vulva distance. We have a stretching of anterior perineum or horizontalization of the vulva and dilatation of the anus. All these modifications can lead to mechanical trauma, injury of fascial connective tissue, ischemic damage, neurological damage, and iatrogenic damage for wrong suture. The symptoms of pelvic floor dysfunction are urinary incontinence, fecal incontinence, pelvic organ prolapse, sexual dysfunction, which are present in 23 up to 49% of women with a negative impact on their quality of life. So it's very important to say that the perception of these symptoms during the pregnancy and before depends also of the quality of care from the health team. Urogenital symptoms are frequently accepted from women that which may delay diagnosis and treatment. The questionnaire are health instruments that can be useful tools that can help the health team to detect early the symptoms associated with the pelvic floor dysfunction. This review analyzes the most common questionnaire in use. There are 9 questionnaires in use that assess the pelvic floor dysfunction in postpartum period. The most in use is the International Consulting of Incontinence Questionnaire. And this questionnaire is a format that assesses the present, the severity, and associated border of symptoms. It's important to mark that none of these questionnaires were developed to specifically applied to postpartum women. Most questionnaires are developed for the general population. So we need to use and specifically questionnaire for postpartum women. In sorry, we had a problem with the PC. This is in Italian practice, the Perineal card is a rating scale that estimates the risk of a perineal damage in postpartum, taking in account anamnestic factor, urogenital factor, and obstetric factor by the census score. Among the general risk factors, we find the factors that are determined on an overload of perineal muscle, such chronic bronchitis, heavy works, and high impact sport activity. Urogenital factors include urinary incontinence before pregnancy and during, severe constipation, gas, and stool incontinence. We have also laceration, we have the weight of the baby, we have also all the risk factor of damage of the perineum. And with this perineal card, we have a risk in which one the woman that has a low risk, nothing therapy is improved. The middle risk, we have an education and rehabilitation, a short rehabilitation therapy for prevention. In high risk, there is a rehabilitation on the proctology or urogenital therapy. In our center, we have decided to introduce an extra step into workflow, which is an ultrasound examination and gynecology evaluation that assess a specific therapy process. We exclude any avulsion in case we have a big weight of the baby or some problems with the image of the perineum. In case where we can suspect an injury of anal sphincteric, we do also an ultrasound of sphincteric anal imaging to exclude some injury. And if we can take home some message, we must remember that pelvic floor dysfunction is a complex process, secondary to multifactorial etiology. The risk factor we must mark that are present before, during, and after the pregnancy. So the good practice should work over to remove the reversible risk factor like obesity, like habits, like smoking. Extra risk factors arise during and due to the pregnancy. Use behavior therapy and pelvic floor muscle training must be suggested before and during the pregnancy. And all obstetric gynecology departments should use evaluation card for assessing and early detection of pelvic floor assessing risk. Ultrasound system and new software may lead to integrate into the pelvic floor patient workflow. So everything is manageable, but the problem is no. Thank you.
Thank you, Dr. Camella, for this interesting talk. Is there any question? Thank you.